Thank you so much.
Well, this is the fun part of live events, right? You can just switch direction. So I'm really delighted to be sitting here with Senator Roger Marshall, physician, one of the members of the DOC caucus in the Senate, really someone who's thought a lot about food and nutrition from his own experience as someone who's delivered thousands of babies in Kansas and is now first in the House and now in the Senate. We've met in the House when you were still in the House, really thinking about food and nutrition. So you've been a leading voice in the Senate, thinking about the health burdens, the economic burdens of poor nutrition, and how we really have to address this. And I think I've heard you say one of your goals is to reduce healthcare spending, and how are we going to do that if we don't address diet-related disease? And so why do you think Congress should care about nutrition and from your own perspective?
Well, Dari, great to be with you, and thanks to Tufts and Food Tank here for hosting this as well. You and I were talking about food as medicine before there was a MAHA group, that this is just part of our DNA. For me, I was delivering a baby a day, seeing 30, 40 prenatal visits a day, and I just saw my diabetic clinic grow, where I'd have to take every Monday morning and see nothing but the diabetics in my clinic. And certainly there was a nutrition component to this. The average first weight for an OB patient grew 20 or 30 pounds in my career. And with that, the C-section rate, the infection, all those types of things. So, it's the right thing to do, right? My grandma used to say, if you have your health, you have everything. And then you put on your legislator hat and you figure in a $7 trillion budget, we're spending probably close to $2 trillion on healthcare within the federal government. As a country, we're spending $5 trillion a year. And it's always interesting to me when my friends across the aisle, for whatever reason, they'll talk about the amount of money we're spending as a nation on healthcare, but our outcomes aren't as good. And they look at me like, well, it's you doctors' faults. Why can't you fix this? And one of the reasons we have such a high spend is because we're a sick nation. And it's more than obesity. I think it's the inflammatory diet that we had that leads to cancers and autoimmune diseases. And you know what? You and I knew in medical school about nutrition and health with this much, and now it's only this much. But I think we're making progress.
Yeah, I think you're absolutely right. I think physicians aren't getting the education they need, and I think that's something that's now happening. Texas, for example, passed a law that all of their medical schools have to teach nutrition. Other states are considering similar things. I also think your point about how rapidly this has happened is important. This happened in our adult lifetimes. And so for me, that's important. This isn't something that's been trickling along since the 1930s or 1940s. All of this happened, this burst of diet-related disease, around 1990. Around 1990, 35 years ago. And we can actually trace it back to the growth of commodity crops and ultra-processing. And so we can fix it. We can fix it. We can go back and see what we've done and how to fix it. And so speaking of that, among the solutions, one of them is to think about the role of FDA in regulating additives. And there's a provision called GRAS, which has turned into kind of a loophole for the food industry to put in additives to food, but call them generally regarded as safe, or GRAS. And so you've just introduced, I think, an important piece of legislation, along with a couple of your colleagues, to think about how do we fix this GRAS loophole. So why do you think this legislation is important? Tell us a little bit about the legislation.
Well, I think number one is that consumers are demanding this, right? My kids are this MAHA age group, and they want to know what they're eating. So I think the first step is total transparency. And right now there's loopholes, so they don't have to list all their ingredients. So we want to know what's in our food, and then we want to see the science. And if this is science relied upon from the 1940s, do we think that there's different carcinogens? Do we know more about carcinogens today than we did in the 1940s? We did. So consumers are demanding it. Again, it's the right thing to do. And we want to up our game. And I just appreciate the food industry starting to embrace this. I see the fast food industry starting to embrace it as well. We're going in the right step, in the right direction. It'll be hard for government to get this right, though, Dari. It's going to be really hard. It's kind of Goldilocks, not too cold, not too hot. This concept of preemption. There's some really good work done in the states. And they're afraid that I'm going to undercut them, and I don't want to do that as well. So where do where do we establish the guardrails? And I really think that's what this next semester, I'm still kind of in my school mode, our next semester in Congress is what do those guardrails look like when it comes to grass? But certainly we know the status quo is not acceptable. And you and I have had this, where do you think we should go with it?
Well, so for people who are less familiar with this, I'm often asked, how come there's hundreds and hundreds of additives that are banned in Europe, but they're allowed in the United States? That's because the United States is a pretty unique loophole. We don't just have additives. We have a whole second category that other countries don't have called GRAS, generally regarded as safe. And so when Congress created the law many years ago, they said, okay, additives need to be reviewed, they need to be vetted, they need to be publicly sent to FDA. We need to know what's in them. We need to know the safety data. But for things that are generally regarded as safe, industry doesn't have to do that. And Congress intended this for things like ginger and turmeric and black pepper, things that were generally regarded as safe. You didn't have to go through all this rigmarole. But they didn't define what GRAS was and what additives they were. They said GRAS is anything that's not an additive. That was it. They defined it by not being an additive. So industry, of course, loves a loophole. And 99% of additives that are added into the U.S. food supply in the last 20 years have been through the GRAS pathway, not through the additives pathway. And the vast majority of those have never been sent to FDA. Food industry does their own science testing. They hire their own panels of scientists. They keep the data under lock and key. So I think your bill, which first changes the law so that those notifications have to be public, and the FDA has to receive them and publicly release them, I think is really important. I think the second thing beyond public notification is, as you said, to update the actual rules for safety. The rules are really based on decades-old science. And the two things I'd like to see Congress do is to update the rules to say anything put in our food, whether it's GRAS or additive pathway, has to be safe, not just the usual things like carcinogenesis and other things, but also for the microbiome, which the science didn't even exist when the law was passed, and also neurodevelopment in kids. Many, many additives, their pathways are through these two things: neurodevelopment, brain development, behavior, and the microbiome. So I think those would be two really important things. Yeah.
And to me, one of the big emphasis is putting the F back in FDA. And I'm excited with Dr. McCary and what he's doing, and he certainly is committed to this as well. But on the one hand, don't want senators writing these rules either. So we will need a little bit of help from the food part of FDA as well. And truly those closest to the problem understand it better than I do.
Yeah, I think, as you said, the status quo is not okay.
Right.
And these have been problems that we've known about for decades and not fixed. And I think we actually have a unique opportunity to do it. So I think that's really, really wonderful. And so we have a couple of minutes, Senator. And my last question is really about, beyond ultra-processed foods, you've thought about lots of things: soil health for our farmers, prioritizing healthier foods in SNAP, doing food as medicine, for example, through the Medically Tailored Meals Act for Medicare proper. Can you tell us more about your bigger vision of kind of other actions for Congress and how the public and other offices here can work with you?
Right. So DC so much functions in silos, and I'm fortunate to be on the Help Committee and the Finance Committee and the Ag Committee. So what is agriculture's role in all this? And trust me, my farmers want to grow healthy food. So we're trying to figure out, well, what does healthy food look like? And to me, the great opportunity is the focus on healthy soil. Healthy soil is where agriculture meets MAHA. Dari, I think that there are nutrients in soil that we can't even measure. I think there's nutrients in food that we still don't know even exist yet. But I do think that it's going to come from the soil. So by modern agriculture practices, a lot of it's regenerative, precision agriculture, we can get there. We can have a more nutritious food. Quit focusing just on calories. Let's focus on the nutritious content of that food. And so it costs money to do that, to make that transition from the focus on how many bushels of corn per acre can we grow as opposed to a quality. It's going to cost money for this precision. And what I'm talking about is growing more with less water, with less fertilizers, focusing on capturing any type of fertilizer that's out of the soil, keeping it from being in the river, in the air, all those types of things. And so maybe 10% of agriculture is adopting that right now, and they're making incredible gains. But we have the other 90% to do. And one of the big secrets to me is the carbon credit industry. So a lot of the people, whether it's Microsoft, Google, they're buying these carbon credits. So a lot of the things that make the soil more healthy is also very environmentally friendly as well. So we got to be able to pay for these practices beyond what the federal government can do. So that's one example. I'm going to brag on my staff that we got whole milk across the finish line. That's one simple example, but it took us 5 years to do it. Now, you don't have to drink whole milk if you don't want to, but I think it's a very nutritious drink, and it decreases satiety. It helps you absorb fat-soluble vitamins, all those types of things about it. Certainly, it's a better, healthier choice than, forgive me, a cola to drink as well. So those are some simple one-off things that we can do. But my big focus is how do we have healthy soil, which is going to lead to healthier food.
Yeah, I think I'm so thankful you brought up the farmers, right? We talked about RDNs and healthcare and the charitable food system and government, but obviously we have to also help our farmers be successful. And rural economies are struggling, and rural communities are struggling. The American farmer is among the most innovative worker we have in the American workforce. They're really trying to innovate, but they need a market. Many of my colleagues say, we just have to change what the farmers grow. The farmers grow what people buy.
Yes.
And so we have to change the market, change demand through our investments, and also help the farmers with what they want to do already, which is grow healthier food. And I like your focus on soil health, on regenerative ag. I think that's really powerful. And imagine if the U.S., instead of being the country that's exporting ultra-processed foods and illness to the rest of the world, becomes the breadbasket for regeneratively grown, healthy, nourishing food for the America and the world. This is an economic advantage for us as well. So this is really a moment when I think Congress gets this, the public gets this, industry gets this, farmers get it, healthcare gets it, and I think we need to harness all of that. And so thank you for your leadership. Thank you for being here, Doc. I really appreciate it, and I appreciate everything you're doing. Thank you.
You're welcome. Thanks for having me.
Yeah.